So what I'd like to talk to you today about is what you might expect when you come in to be evaluated at your first visit. So we're looking for maybe a thyroid condition, an autoimmune condition. So I want to kind of go over what you might expect when you come into our office. So we're going to look at many different factors that go into this. We want to go over a couple of those things. The first thing is diet. We want to know what fuel you are giving your body. What is your diet like? And we want you to be honest with us. We want to know. So what food are you taking in? How much water do you drink? How many sodas do you consume a day? How much coffee are you relying on? And we don't want you to shape up your diet 2 days before you come in so you can give us a good report. We want the honest truth. We want to know what fuel your body has been getting during this time frame that you've had all these symptoms. So we're going to go through a very extensive diet history with you so that we know what fuel your body's been using. The second thing is exercise. We want to know how you're expending your energy. What do you do all day for work? Do you sit? Do you stand? Do you do heavy labor? Do you exercise at the gym 7 days a week? Do you exercise none? We want to know how your cells are being expected to use their energy. So we're going to go through diet and exercise journals as to what you've been doing. Labs are essential for us. We have to know at the blood chemistry level what your body's doing. And we're not talking about, I had a physical last year or even last month with my primary care doctor. Sure, they checked some basic labs on you, and that's great, but they were looking at that from a lab normal. So what did the lab say the normal values were, and did you fall into that category? So we take things from a different standpoint on looking at labs. We want to know multiple different organ systems. We look at cardiovascular function, your heart, your liver, your stomach. Are you converting protein like you're supposed to? Is what you're eating actually doing what it's supposed to in your gut? We look at your thyroid. We look at your pancreas. We look at your immune system functioning. And we look at it through what we call optimal levels, not just lab normals. I want to know from a functional standpoint, we know what values give us the best energy level, the best outlook, the best quality of life. So, and those aren't always lab normals. So a lot of times people bring me in a lab report and they're like, look, all my labs are normal. And when we actually put them into functional ranges, half of their values are out of normal. So sure, they may be the lab normal, but they're not functioning at optimum. They're not feeling great. They're still symptomatic, or they wouldn't be sitting in my office. So it's very important for us to get those labs done. And it's just a standard blood draw. There's nothing much different than what the labs you did at your family practice as far as the procedure. It's pretty painless. They're sent off, the labs come back, and they're reviewed under what I call a functional microscope. We want to look at all the dirty details of every value and figure out how it all fits together. So we're not just looking at thyroid labs or just looking at immune system labs. We're looking at everything together and how is one affecting the other. So labs are a very important part and part of all of our evaluations for autoimmune or thyroid conditions, or any real investigation of symptoms require that comprehensive panel. Medication. So not just because I want to know what meds you're on, I want to know how those medications are affecting your organs, affecting your cells. The side effect profile on pretty much every medication out there is long. So we want to know, are any of the medications you on actually hindering your body from doing what it's supposed to? So it's real important that you bring with you to your appointment a medication list with a dosage, and if you know, or even roundabout how long you've been on it, that's important for us to know as well. And then a health history. So we're going to ask you tons of questions about what symptoms you have, and even if they're things that you think you aren't coming in to see us for, a lot of times we can show you what that link is to those symptoms. So we're going to do a comprehensive health history. We're going to look at, what you've gone through in the past, what treatments you've already tried, and how those treatments, how you responded to them, what happened when you were on those. Now, it's important to know that this is not just a 5-minute office visit with us. We take a lot of time and a lot of pride in doing this comprehensive evaluation with our patients, and we look very forward and hope to see you in our office very soon.